I call the member for Ryde.
Thank you, Speaker. On the 17th of December this year, Ryde residents and many more from around New South Wales will gather at the North Ryde Common for the second largest Christmas carol event in Sydney. For over 30 years, save for 1 year during COVID when they had to move to another site, the Rotary Clubs of North Ryde and Macquarie Park have hosted this extraordinary event at the Common, bringing together thousands of local residents to celebrate and sing in the spirit of the Christmas season. Every local kid remembers the carols growing up. School holidays have started, there are spectacular fireworks, and we all get up to some harmless mischief. Families love it too. Of course, the carols are a wholesome opportunity to come together, eat great food, and support our local community groups and associations. This year, I'm sponsoring the Ryde tent, who provides support accommodation for people living with intellectual disabilities in Ryde. Next door to the Common is the Ryde Mental Health Hospital. It is an understated facility that has helped support people with acute mental health and rehabilitation needs since 1956, for over 65 years. New South Wales Health speaks to the 195-bed facility as being fully integrated into the local community, with gently sloping trees, filled land with views to the north, east and the city skyline. Many patients are known to the residents and businesses of Cox's Road, where they are empowered to reintegrate into the society after what can be extremely challenging periods of their lives. The hospital also has a strong history with the University of Sydney School of Medicine, helping train and nurture a future generation of healthcare practitioners, specifically those based in the Ryde area. It is therefore an extraordinary blindside to the community to have learnt through reports in the Sydney Morning Herald of a secret plan to develop this site with high-rise housing. As a former mayor of Ryde, I thought for sure that there must have been some consultation with the council that would have confirmed that this wild idea was not a serious consideration, perhaps just a thought bubble that was to go no further. After all, council had been the custodian of the North Ryde Common site for several decades, maintaining the site and creating activity through sport and recreation for many local user groups. It would be revealed almost immediately that this was not the case. Council had not been informed, and nor had the community. The government is rightly pursuing an agenda of delivering housing supply, yet fails to strategically plan for our city's future. Even by their own standards, North Ryde Common falls foul of a sensible site for high-density housing. They claim to target sites around metro stations. Very logical. Yet North Ryde Common is at least half an hour's walk away from the nearest metro at North Ryde, a station with no parking. It is lightly serviced by the odd bus route, and local roads struggle with the existing through and residential traffic. I can think of few places worse for high-density living than the North Ryde Common and Macquarie Mental Health Hospital site. I suspect that this is why our community petition attracted well over 2,000 signatures in just the first couple of days, and why, as I door-knocked the community, residents literally ripped the petition from my hands, desperate to register their objection to the Minns Labor government's short-sighted bid for easy development. Of course, this isn't about opposing housing. We know in Ryde that we've exceeded housing targets by well over 50% for successive years and will likely continue to do so. The community are not unreasonable people and have been patient as they wait for this new government to deliver as it has promised. Yet they have been left disappointed with broken promises, and this proposal, never announced before the election, would irrevocably grind our community to a halt. Delivery of new housing without requisite infrastructure is a recipe for disaster and a product of poor planning. Just today, in question time, the Minister for Planning mocked the community opposition, essentially committing the Minns Labor government to developing North Ryde Common and Macquarie Mental Health Hospital. This is despite overwhelming opposition, including by local Labor branch members and representatives. I want to thank the local community for their continued support on this issue and acknowledge some of the unsung heroes, including the member for Lane Cove, Ryde councillor Sophie Lara Watson, who moved a bipartisan and unanimous motion through council to object to this proposal, and residents like Dee, Trish and Therese, who helped Sophie and I door-knock the community just last week. People power can and should win, and I urge the Premier, his ministers and this Labor government to join with us to save North Ryde Common and the Macquarie Mental Health Hospital.